Hi, everybody. This is Jessica Stone at Stansberry Research. I'm joined now by Amanda Cuocci of the Health and Wealth Bulletin. And Amanda, we are constantly seeing evolving guidance on the connection between COVID-19 and kids. Obviously, right now, a big source of communication and conversation among parents is whether kids can go back to school in whole or in part. And a lot of that really has to do with how dangerous this disease is to the kids and also to the teachers. What do we know about the risk of COVID-19 to kids now?
Younger kids, especially if they're 9 and under, they're not really getting the virus. And a lot of that, scientists believe is because they haven't quite developed the receptors yet. In past videos, we've talked about that ACE2 receptor. It's especially prevalent in our nose and our respiratory tracts. But kids aren't really, they don't have enough of those to really get enough of the virus particles to make them sick. Now, there have been some reports that kids may get it and just be asymptomatic.
Mhm.
But we just don't have a whole lot there. I know there was one study, I believe it was out of China, where they looked at a bunch of household infections. And in those households, the children, especially the younger children, were not the ones that brought in the virus. They were not the ones that infected the rest of the household.
So, Amanda, I noticed that the CDC hasn't changed its guidance yet, and presumably there would have to be a lot more evidence that kids were at lower risk for it to do so. What about the risk to teachers and other people that work at a school?
So I think that's the bigger question here, because whether or not kids are going to be the ones spreading it the most or even at all, they don't exist in a bubble in a school. There's lots of workers, there's lots of helpers, there's lots of staff and support staff. I have people like that in my family, people who work in the school system who are going to be at risk simply because they're in close quarters. They may or may not be getting it from asymptomatic kids. Or if the kids are older, we were saying the 9 and under group is less likely. But if you're working with preteens and teenagers, you could still be at risk for transmission. So one of the things I was looking at is, there's this study out about 20 different countries that have already reopened their schools and sort of what they've been doing, what they haven't been doing, what's been working. And what they're really finding is that if they adhere to things like social distancing and mask wearing, keeping the number of kids lower in the schools, so maybe like staggering how many kids go in per week, they're actually having a much better success rate. But here's the thing. All of these countries didn't open schools until the epidemic was already at low levels of transmission,
Mm.
right? And we're not quite there yet in the US. We're still having, we're seeing these surges in different hotspots. We're seeing the R naught rate keep increasing. It's the rate of transmission. So there's a lot more that comes into play here, especially with where the school is located. So personally, I think it might even come down to like a state by state decision. If your
Yeah.
state has no surges, no hotspots, your R naught number is low, maybe it's time to open up, maybe not. But that's really that decision based on, health officials and what's best for the area. A lot of grandparents are actually stepping up now to take care of some of those childcare responsibilities. They're watching the kids after school, things like that. If the child gets COVID at school, they could bring it home to grandma, grandpa. They're at higher risk of severe infection.
One thing I think that is sort of missing from the debate is the health impacts of not being in a classroom for your education, of not being connected to the school district. The school district is like the point of contact for services for a lot of kids, whether it's school lunch program or health and eyesight treatment, or even detecting child abuse. I mean, the mandated reporters are usually in the school. So, what do we know about the health impacts of kids not going to school?
And that's a great point too. I mean, there's already been reported, kids not just falling behind in learning, but also in socialization and developing social skills and things like that. And then exactly what you just mentioned, most kids in certain parts of the country, that's where they get their hot meals during the day, is through school. The
Mm.
child abuse numbers we're seeing, they're still coming out, so it's a little bit mixed right now, but that's definitely a concern. I mean, if they're not getting picked up early enough by the mandatory reporting at school, what's that situation going to be like, especially as people get more and more, stressed out and possibly more violent as this pandemic goes on.
Yeah, and I just want to point out with respect to the domestic abuse, I think one figure I saw was that there's something like a 30 or 35% increase in the numbers of children going to the ER for domestic abuse or possible domestic abuse.
And actually, the American Academy of Pediatrics, the AAP, they're behind sending kids back to school for all of these reasons. They want them to be safe. They want them to be, in a social, structured environment. I mean, kids thrive with structure. But they also advise that you have to follow the health mandates laid out by your state and area,
Mhm.
because that's so important. We still want to keep them safe. We want to keep the teachers and the workers safe.
Yeah, I just can't help but wonder, and we won't know right now what the overall economic impacts are between what we're seeing with women coming out of the workforce, and you and I have talked about that a little bit offline, and what we're seeing with children not having access to the same level and standard of education. I mean, it all sets us all back as an economy and as a people. Our thanks to you, Amanda Cuocci. I know you'll be keeping on top of these trends and what they mean not only to our health, but to our wealth as well. If you would like to see more of Amanda Cuocci's writing, you can hover on the screen and connect to her through the subscribe logo on the screen. Also, please do visit YouTube and subscribe to our YouTube channel. You can also find us on Facebook, Instagram, Twitter, and LinkedIn. Thanks for watching. That's all for now.